Hi, I'm Dr. Henele, and welcome back to Release Point Therapy. When last time we spoke, we were talking a little bit about superficial fascial expansion, and especially getting into going from the fascial hold to actually moving through the tissue in a fluid, non-forceful, but still very effective way. One of the things I wanted to share with you now is why do we need to walk through the tissue? So come on a little bit closer. I'm going to use this sheet as an example. And actually, let me back off the sheet. Why don't we use my shoulders example? Let's say we are looking at a person, they come in and they can't really have the full range of motion they want with their shoulder. They're having a hard time lifting it up. Well, part of that can be because, as you see here, come in a little bit closer. Let's say they had a pre-existing injury, little rotator cuff injury. What happens in the soft tissues of the body is they start to bunch up. And as you can see here, it creates lines of tension throughout the soft tissue. And this is our skin, our soft tissue, our fascia is much like this shirt. If this bunches up and then tightens up a little bit, because that's how the body splints itself to prevent further injury, what that does is it restricts our range of motion. And if it restricts it enough, maybe we have some nerves trapped in there, that can start to feel quite painful. So I'm going to ask Tyler to come on in here, and he's going to show you a little nifty trick about what the fascial hold does. So Tyler's going to grab a little bit of my shirt using the fascial hold as an example, and he's going to start to lift away from this tension where you see my hand clasp, and you see how he's engaging the tissue here, and he's starting to open it up, and a pocket of scarring becomes apparent. Now, that's all he might get there, so now he starts moving around, walking to a different place, and he wants to engage each of these fascial lines until he gets the right place and lifts, and boom, gets it all out. And now what we have is smoothed out tissue and a better range of motion because there's more space. Now, problem with this potential. Problem is, if a practitioner works too hard, too fast, it can be quite painful. And that's certainly something we don't want to do with our clients. Number two, if he is working too fast or too hard, he should be watching the breath because the breath will begin to shut down. So that's always the monitor, that breath. Third thing though is now your client goes home, they're feeling great. Oh, my shoulder hasn't felt this great in weeks. Oh my God, I can move it around. My golf swing's going to be incredible. This is fantastic. Then they get home and they start getting a little bit of a fever. This is what's called a healing reaction. What's happening is the body is heating itself up. It's getting the nervous system and the immune system online because in those little pockets that Tyler opened up were probably subacute infections, old viral remnants, old bacterial remnants that in effect got released, opened up. And so now this heating sensation, this warming sensation, this flu-like symptom that your client may be feeling is actually a very good thing. They might not enjoy it, but it's a great thing. It's one of the reasons why we always tell people to drink plenty of water when you finish a session. What we do with release point therapy when it's practiced optimally is we say, let's get your nutrition together as well. Let's get your body alkalized, and let's also detox you. So one of the things we do in clinic here at the Genesis Center for Advanced Natural Healing is we put people in an infrared sauna and we sweat them out after every session. And what's been amazing over the last 3 years that we've been doing that is that the complaints following the session of, oh, it was hard, it hurt, I'm sore, it was too painful. All that stuff magically disappears because the real problem of why people hurt after a session is not often the therapist's hands, it's what's going on in a person's body. It's the infections, the environmental pollution, the poor diets, those kind of things that throw off their pH and cause for tenderness in the tissue. So, a lot of information there, keep all of it in mind, but remember this. If you watch your client's breath like a hawk and you see the breath moving, you're never going to take them too far past what they can do. Thanks.